Hello, we're going to be talking about COVID boosters today and what you need to know about that. I am Janelle Friesen. This is the weekly update video with the UG Public Health Department. I'm here with Dr. C. You want to say hello again?
Sure. Hi, everybody. I'm Dr. Corriveau. I'm the Deputy Health Officer for the Public Health Department in Wyandotte County. It's good to be back with you.
Yeah, it's always good to have you on here. And I'm interested to talk to you about boosters today because I think, as most people have heard at this point, there are boosters available for all three types of vaccines now, whether you're getting the Pfizer, Moderna, the J&J. So I want to talk a little bit about the eligibility and how it works. So can we start by talking about if somebody previously got Pfizer or Moderna, what they need to know?
Yeah, absolutely. Well, first of all, Janelle, what I'll say is that, we were talking previously about third doses of the vaccine. And so remember those people who have severe immune compromise conditions, issues like having cancer or organ transplants, they're already eligible for that third dose, and they have been for quite some time. And the big change that happened is that now we're talking about booster shots. So people now who are, over the age of 65 years old, maybe living in crowded conditions or have medical conditions that maybe put you at higher risk for a severe case of COVID. Like that would even be like obesity or high blood pressure. So above 18 years of age, if you previously have been fully vaccinated for either Moderna or Pfizer for COVID-19, 6 months after that full vaccination, you're now eligible for a booster. And so this was a big change. The other thing that just came out is we have to remember our friends who received the Johnson & Johnson vaccine. So for a long time, we didn't have a lot of information about second doses or booster shots. But now for anyone who received the one J&J vaccine, 2 months after that initial vaccine, they're eligible for a booster shot.
Okay, so with the J&J or Johnson and Johnson, that's anybody 18 and older, 2 months after that first dose. And with the Moderna and Pfizer, it's 18 and older with certain, criteria that put them at a little bit higher risk, and it's 6 months out. Is that right?
That's exactly right. Yeah. So it is interesting that anybody 18 or older who received the Johnson & Johnson vaccine, it is recommended that you go ahead and get a booster shot. Now, Janelle, the other thing we should talk about is which booster shot should you get? Because it's kind of interesting that there's a choice about it, a choice in the matter. So we're allowing mixing and matching, which is interesting, I think. Most people we find are requesting that they get their booster shot in the same, type of shot that they initially received, but it doesn't have to be that way. We don't have any specific recommendations as to what the booster shot should be, although I'll say that some of the data showing that people who received initially the Johnson & Johnson vaccine, when they get boosted with an mRNA vaccine, either the Pfizer or Moderna shot, it looks really good for their immunity, into the future. But ongoing studies are happening. So just get a booster shot. You can choose which one you want.
Great. So just when you go to get that booster, let them know if you have a preference about which one you want to get.
And please, please bring your card. We really need everyone to bring your vaccine card with you. It's really important because, when you get your booster, we're going to go ahead and just add on to that card. So it'll just look like you've had 3 doses of the vaccine. The other thing that I want to quickly mention about the Moderna booster is that this is the only booster shot that's actually a different dose than the original shot dose. And so it's going to be a half dose. And so that was found to be very effective as a booster as well.
All right, great. So how can people find where they can get a booster?
Well, our Kmart site is open and ready for you all to come and get your boosters there. Remember that that's at 78th and State. And I believe we're giving shots, is it Wednesday through Friday? Janelle, you know the hours better than I do. They've
The
changed.
Kmart's Wednesday through Friday, 10 a.m. to 6 p.m.
Perfect. Yep. And then I believe in the future, we're going to be offering vaccines at our public health department site there right in the middle of town. Although that's not offered quite yet, we're going to be taking appointments in the near future for vaccines. So keep your eyes peeled for that information.
Yeah, and you can always search for other vaccine sites at vaccines.gov, find a pharmacy or a clinic or other places that offer COVID vaccines. There are a ton of different providers where that's available now. So I want to wrap us up with something that's not actually about boosters, but has been in the news a lot, which is the potential for COVID vaccines for kids ages 5 to 11. I know that people are asking a lot of questions about it, want to know like what's happening next. So can you give a quick update on that?
Sure. I think this is going to be a really important decision that's made coming up. We heard from the FDA that they're saying thumbs up on vaccines for kids 5 to 11 years old. And so we just haven't heard yet from the CDC or from our state health department here in Kansas as to how to proceed. And so we're expecting that within the next couple days, maybe by even next week, we'll be able to offer vaccines for children. We just don't quite have all of the information yet, but again, it's looking good.
And my understanding is that we may hear, by next week potentially whether that's going to be authorized and recommended, but it could still take some time before they're available, both because of supply and getting, it's changes for the staff and the operations for what that looks like for this different age group. So it may take a little time even after that initial announcement from CDC or KDHE before you see that at vaccine sites near you.
That's right. And we should say that this is the Pfizer vaccine that's being debated and thought about for our kids. And it is at a lower dose than the adult version. And so that's really why there's a lot of changes going on. We need to make sure that all of our staff are ready and they know exactly how to do the right dose for kids. We're definitely going to be requiring parents to give the thumbs up that that's okay to get this vaccination for their children. And so we just want to let you all know that you have the opportunity to say yay or nay for your kids, and we'll be happy to vaccinate them as soon as we possibly have all the supplies and are ready to do so.
All right. Thanks so much for that. And we'll keep people posted. Well, we'll see everyone next time.